And if, in fact, we do see a turnaround and a resurgence, we have to be able to pivot and go back to any degree of mitigation that is commensurate with what the situation is. So we can't just say we're done, now we're going to move on. We've got to be able to be flexible because we're dealing with a dynamic situation.
No, that clip is not from 2 years ago when COVID started, but today, now that COVID is over, and Dr. Anthony Fauci still cannot read the room. Evidently, CNN can't either. Joining us now, Tony Katz, author of Eat, Drink, Smoke with Tony Katz, who can read just about any room. I can deal with masks on planes. I can deal with other people wearing masks, do whatever you want. I just cannot deal with him anymore.
Deal with him, deal with the idea that he still wants you to think that if we see another variant, we all have to shut down. CDC stands for Cirque du Soleil, I guess. Everything's a circus act. Everything's a contortion. Everything's a movement that he's trying to bring and the CDC is trying to bring to get you to somehow feel a little bit of fear or somehow think, oh, it's not over. Or maybe to elevate his own presence. He's been there for 50 years. He's got a presence. He's the highest paid guy in D.C. I mean, you would think that his mother would be more proud of him if he went into private practice and maybe made a real living. But he's the highest paid guy in government. And he's still pushing the same nonsense.
Well, what I can't understand is sort of the need to continue to ring the alarm bells when, first of all, nobody's listening anymore. But second of all, there's very little, if any, evidence to think that the alarm bell needs to be rung. And look, we don't want to take away from what Dr. Fauci did for the first 48 years of his career. His work on AIDS was exemplary. I mean, some of the things he's done for public health and for Ebola, I remember interviewing him. He was incredible and the voice of real calm when there was true panic in America. But then you get to the point that when it comes to information about COVID-19, which of the following sources would you say you trust? Only 30% of Americans say they trust him. Yet Jake Tapper has him on, and this was one of Jake Tapper's questions. Take a listen. This is after saying we may have to shut things down again. Listen to Jake.
But do we know what the percentage of people that die every day are vaccinated versus unvaccinated versus vaccinated but not boosted? Is there a breakdown like that in terms of if 1,000 people die in a specific day?
Yeah. I don't have the precise number, Jake, but it's something around 90% weighted towards the unvaccinated, if not more.
What I couldn't understand is after Fauci started saying we've got to be flexible. We're going to pivot and go back to mitigation, which is code for masks and shutdowns and kids wearing masks and on and on and on. That Jake didn't go like, hey, time out. Like, really? There's just no understanding of this.
We proved that cloth masks don't work. We proved that masks that are not worn properly are only 3% effective. We have no idea why we're still wearing a mask on an airplane, even though TSA has us going through until April. But if you ask the question of why he's doing this, your problem, Leland, is that you're on TV every night. And every night there's this camera that's in front of you and you do that hair, not as good as mine, but as good as you can possibly do. And you get to talk to America. We had a month without Dr. Fauci. We have a war in Ukraine, and I don't want to, somehow diminish what's happening, but a month that Fauci had to go without a camera, and he got himself a little flustered. He didn't know what to do with his day, wandering around the office. So he said, you know what? Let me say this. It'll get me back in front of a camera. I'll be back in the light. I'm going to be a star, Mom. That's very much the Fauci way.
I don't want to be that cynical, but it does feel that way. I can't figure out another explanation. Fauci, though, is now saying he might retire. I have said that I would stay in what I am doing until we get out of the pandemic phase, and I think we might be there already. When I do decide I'm going to step down, whatever that is, I'm going to have to figure out what it is I'm going to do. You're 80-plus years old. What I can't get over is only 30% of Americans trust you, and I bet there's going to be at least 2 cable television networks who are bidding for his services as a medical contributor.
Yeah, Sanjay Gupta better be working on his resume. That's absolutely, positively correct. Look, my father is 84 and he still gets up and works every day. I think there is something to working. You got to use the mind. The difference is my father actually provides something to society. Dr. Fauci hasn't done that in these past couple of years, and there's arguments about whether he's done it even before then. If he's worried about, well, I should just keep doing this because I've got nothing else to do, that is a weird kind of look into who Dr. Fauci is. And I think the 30% number that you're quoting there, I think that's fascinating because I don't think the numbers that is that high.
Yeah, well, that was back January 13th. You make a great point, and there also has to be a realization a little bit about whether or not at 82 or 83 you really still have your fastball. Because all due respect to your dad, there's not many 84-year-olds who do. Tony, you will have your fastball after 80 years old. We got to run. Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.